C'est parti pour la rencontre avec Jessica Whitney, qui est la directrice de Safe Haven ici au Cambodge, à Siem Reap. En cette saison de coronavirus, vous verrez que les locaux sont vides. La bonne nouvelle, c'est que du coup, j'ai eu beaucoup plus de temps à passer avec Jessica, donc j'ai pu poser beaucoup de questions. Et vous allez voir que cette association fait un travail de dingue. Nice to meet you. Thank you for your time. Thank you for having me here. It's been crazy days since a few weeks for you, so we'll talk about this later. So first, I mean, can you explain what is Safe Haven?
Safe Haven is a small NGO in Siem Reap, Cambodia. We're registered in the US as a charity. We're also registered with the government of Cambodia as an NGO. And our purpose is to provide direct services to children with all kinds of disabilities and their families. So we provide a multidisciplinary service to assess the needs of these children and think about how we can help improve their health, their strength, their function, their safety. And our team of all Cambodian staff then work together to implement this plan and strengthen the child and family as much as we can.
Okay.
Safe Haven was founded by an American woman named Heather Connell, who had visited Cambodia several times for various reasons. And around 2008, I think, she met a young boy with cerebral palsy who was living in an orphanage. And she could see that the people caring for him there really didn't have any information or education at all about what he needed to be properly taken care of. So she went out into the community to look for some kind of service that could help him, and she couldn't really find anything. And she knew if there was that one boy, there must be others. In fact, Cambodia does have quite a high rate of disability. And she decided she would do a more formal needs assessment to figure out, was this a needed service? Is anyone else providing it? And in the end, she decided that it was needed. It was needed here in Siem Reap, and she started Safe Haven. Around 2010, she started with hiring one Cambodian staff to do a lot of outreach to various villages and gathering information about children and the kinds of disabilities they had and where people were living who needed the help. And then in 2011, she hired a Cambodian physiotherapist and myself. I was very part-time at that point, and my background is as a nurse. So we started then with 2.25 staff in 2011. And now in 2020, we've grown to 13 Cambodian staff, and I'm still the only foreigner involved directly. There's a huge range, obviously, but I will tell you the story of one child because he's really a great example of many, many children that we meet. So we met a young boy back in 2014 or 15, and at the time he was 8 years old, and he had quite severe cerebral palsy, so he really couldn't move, and he couldn't speak in any way that people could understand him. And he had spent his entire 8 years of his life lying on his back on the floor in his family's house.
8 years.
8 years. His family, like many, many other Cambodian families, just had no idea that he had potential to do more, and they had no idea who could help them, and they had no idea what to do to help him. So they, fed him and clothed him and kept him safe in the house. But of course, that's not much of a life for a child. Over a period of several years working with him, because it does take a long time. Change comes slowly, both change in the child's condition, but also change in the family's understanding and confidence in the fact that any of this will work, or keeping up the work that they need to do to really improve their child's condition is a lot to ask of them, so it takes time. But he went from being a child who had literally spent 8 years lying on the floor, who in fact the first time we set him up with support, he felt completely dizzy because he never had experience being in that position. So it was a very long, slow progression. We provided physiotherapy services to try to help keep his body from getting tightened up and uncomfortably stuck in various positions. We provided a lot of nurse services so that he got medication for seizures that he had been having, but he had not had any medication for those in the past. Lots of general hygiene, toothbrushing, safe use of medications, how to treat fevers. A lot of that very basic health literacy is something we provide to a lot of families. Social workers were there to just talk to the family about general social situation and stresses. Families with a child with disability often experience a lot of stigma and discrimination in the community. They tend to be poor families. Poverty and disability are often linked. And one more service we provide is we have staff that we call interventionists, which is difficult to understand term, but they're essentially child development specialists. And so they do a lot of work with parents and children, looking at the child's developmental milestones and thinking about how to help the child make progress, whether it's fine motor skills, social skills, communication skills.
Okay.
So all four of those services work together to provide for this family and this child. And by the time we eventually stopped providing service, about 5 years later, this was a child who could sit up independently, who could move his own wheelchair around a little bit, had some limitations, but to be able to even turn from right to left was something he'd never been able to do before. He could draw, he could color, he loved to play games. He loved to get out in the village and watch people playing volleyball or just watching the world go by. And it was a dramatic difference that again happened slowly, but that's what's possible. So that's what a life for a child with disability in Cambodia can look like. It can be pretty bleak, as it was before we met him. But there's great potential for it to be a far more meaningful and productive and satisfying life. And that's what we're shooting for with all of these kids.
So during the first 8 years of this child, do the parents try to contact any public hospital or any organization?
What we find in general with families is that many of them have never gone to any public hospital. The healthcare system in Cambodia has limitations, so most people's easiest access to healthcare is through their local village health centers, who don't have much capacity to do anything related to disability. And they may then refer the child on to a provincial health center or provincial hospital. There are also in Siem Reap 2 NGO children's hospitals that can provide service at no cost, which is great, but lots of people who live in rural areas don't know about that. Even if families know about the free care that's available at the children's hospital, they still have to be able to travel to get here. And for people who might be living on $3 a day, $4 in transportation to get to the hospital with no guarantee of any result means that nobody's eating that day. So there's a lack of awareness of the services that are available. There's a lack of ability to access those services, which is a big part of why a lot of what we do is in the family's home, so it's easier to provide the service where they are instead of asking them to come somewhere else. And even when people had gone to the hospital, there was often a lack of understanding. Communication between doctors and patients here is quite different than what we're used to. Patients don't generally ask questions, and doctors don't always have time even to share information. So another boy that we met was having seizures multiple times every hour. And when we met him, he was about 7 years old. And we asked his family, had you ever brought him to any hospital to try to get help for this problem? And they said, yes, we brought him to the children's hospital. And they gave us medicine for 1 month. And we took him back home and we gave him the medicine every day. And his seizures almost stopped. And then when the medicine was finished, the seizures came back. So the medicine didn't work. Their understanding was the medicine would cure the problem, and they didn't have enough explanation or understanding to realize they have to come back every month, and the child will need to take the medicine for many years. So there's just in general, particularly in the rural population, there's quite a low level of what we call health literacy.
Yeah.
People just don't understand some basic things that a lot of us take for granted because they just haven't had the opportunity to learn it.
Yeah.